Let's talk about Reiki. Hello, Dr. Holly here. As a lot of you guys know, I am actually certified in Reiki. I'm also certified in Helms acupuncture, and those two things are actually related. They are both healing modalities that use energy. Um, the energy healing is something that's been around for a long time. Traditional Chinese medicine, Ayurveda, all the older medicine modalities, rituals, all of these things that we had way before Western medicine came about, uses and used healing through energy. So, what exactly am I talking about? Part of why I brought this with me today is to talk about the chakra system. This is one of the systems that is used to think about energy healing and what that means. So chakras mean wheels. It is Sanskrit for wheel, and those are energy centers in your body. There's actually thought to be about 100 of them. These are the 7 main chakras. So it goes from root, which is thought to be the color red, and at the base of the spine, up to the sacral, which is orange, solar, yellow, heart chakra, which is thought to be green or pink, throat chakra, which is thought to be blue, third eye chakra, thought to be more in the indigo purple, and then the crown chakra, which is actually thought to be above the head, is in kind of the white space or all color space, depending on who you're learning from. And part of why I'm showing this to you is because these are thought to be the centers of energy. And when we talk about energy healing, a lot of the time we're talking about energy getting stuck. So part of why acupuncture is used as an example is because it is thought that energy is stuck through the different meridians, which are another way of kind of thinking of this energy moving through the body. Reiki or healing touch or those modalities also use healing through energy to unstick energy in whatever space that may be. So all this may sound a little woo and a little, unsure if you're kind of used to the Western medicine model, but it's actually been around for a long time. Reiki's been around since about the 1920s in Japan when it was first discovered or remembered by Reiki master at that time. Traditional Chinese medicine has been around for even longer than that. And as far as other energy modalities, things such as Qigong, Tai Chi, yoga, you guys have probably heard about these things, and they've been around for a very long time. And they're also about moving energy in your body. Some dancers will talk about moving energy when they're moving. Athletes will talk about energy in their body and about maybe getting stuck with pain or injury. And that's why the energy modalities are super helpful for things such as pain or having stuck feelings in your body. So Reiki specifically, when I became certified in Reiki, I trained with a Reiki master. I did a couple of levels of training. I learned things like using a pendulum if I'm checking someone's chakras either in person, or I can use my grid to do that virtually as well, or just energetically as far as what I'm tuning into. And that's a lot of times based on the level of experience of the person practicing. But these energy modalities, we think about 1 to 5% of the population uses them regularly. But if you look specifically at folks in the rheumatology area, so folks dealing with pain, chronic pain, issues within their body, whether it be their joints or systemic issues such as autoimmunity, up to 43% of those folks are using energy modalities for healing. So that makes me think there's something to it, right? There's about moderate level of evidence for use of Reiki and healing touch and those type of energy transferring modalities for things such as pain, chronic pain, cancer-related pain, also Crohn's and GI issues related to inflammation such as Crohn's or something happening in your bowel. It's found that healing touch and Reiki can be helpful for that. Anxiety. When I've done Reiki with folks, they often talk about feeling a sense of calm, which of course is going to help that relaxation response happen rather than that fight or flight. So it's super helpful for folks kind of taking things down a notch. And there's a lot of evidence for using Tai Chi and yoga for things such as PTSD, anxiety, depression. And so it makes sense that other energy modalities also are helpful with this. The reason we don't have as high a level of research as we would with, say, checking medication or checking a procedure is because it's hard to kind of have a control for energy healing. And so it's more that it's hard to do in a lab, kind of in a controlled environment, and to make sure it's done the exact way between practitioners. So that's why the level of research isn't at the same level as, say, a medication where you're taking a pill or you're taking a placebo. So that's, you have to kind of keep that in mind when you're examining the level of evidence. So when a moderate level is actually pretty good, considering it's hard to run experiments on energy healing. So when I am doing Reiki with someone who comes to see me, what can they expect? So Reiki is a type of ritual practice, which again is part of that feminine aspect of healing, which I embrace because it really is patient-centric or person-centric. It's about our relationship. It's about the healing happening in the room and not what the insurance company is telling us to do. So it starts with a ritual. There is what we call a Reiki prayer that those of us who are trained in Reiki do, and there's certain kind of hand gestures that we do and types of symbolism that we use to kind of activate the space. So that's really, again, about that ritualized, creating a sacred space, a safe space for all that are included, be it myself as the provider or the person who I'm working with Reiki and that energy healing. And then I either, depending on the type of visit, if it's a short visit, I might be drawn to a space that is energetically kind of reaching out and needing some love, or if I know that there's an issue like a back issue or a headache or something that's kind of drawing me there. And then we do have pendulums that we use to evaluate the chakra system. So that is on 3 levels, the physical, the emotional, the spiritual. And so that is a little more complicated. So that's a lengthier visit. That's more of an hour-long visit where we are checking each of those 7 levels and seeing if they are in alignment with the others or if they are moving differently and out of alignment. And those that are out of alignment, we offer some Reiki energy to offer some healing. Then we recheck, and that's kind of a back and forth that happens. Something to keep in mind if you're someone who's dealing with a lot of pain and want to try out Reiki. If you have chronic pain, that means that energy's been stuck for quite a long time. So adding more energy to it might cause a bit of a flare at first. So that's not to say that will happen. It's just to say that you need to be mindful of who you're visiting and not just kind of pick someone off the internet. Just like find someone that you have a relationship with that knows your body, that knows your triggers, whether it be physical or emotional, because a lot of our emotional concerns can come out in the physical. So it's not uncommon for my folks who have issues such as depression or bipolar or anxiety to feel more pain when those things are flaring, because even from a Western medicine standpoint, that just makes sense. It's a lot of the same neurotransmitters are controlling mood and pain. But that also makes sense with our energy. So you want to make sure you're seeing someone who's certified in Reiki, who's been trained, who is familiar with working with folks with pain, and who you're comfortable giving feedback to. Because if you're having a flare of pain, that might be a gentler approach that is needed and one over time rather than one, big long session and then, see you in a month. It might be a matter of like maybe some shorter sessions over a week to kind of help that pain slowly subside rather than kind of putting a bunch of energy into a stuck space all at once. So I hope that serves you. Please feel free to reach out if this is sounding interesting. I give more information about these things, more specific information within the Dara Wellness crew, which is our community that centers around integrative medicine and integrative psychiatry and mind-body medicine, and really about embracing health and giving people the information they need to be active consumers of their own well-being, and to use all the evidence that is out there to help them advocate for themselves when they are reaching their goals in being their best selves. So please reach out if that sounds interesting, because I would love to have you join our community. You can check out my website, darawellnessnola.com. There's a free course there on integrative psychiatry and using it for things such as sleep, anxiety, stress. So check that out if that sounds informative. It's absolutely free, and I love educating. So please check out my YouTube, check out where you're seeing me here to get more info, and have a great one.